Bismillahirrahmanirrahim. I am Dr. Sayyid Raza Muhyiddin, member of the visiting faculty Time Institute Multan for MPH classes. And today is the 8th lecture of health system analysis, health policy and planning. Today we will discuss the health management information systems. As in the first semester, you have learned the definitions and details of the epidemiology and surveillance. Epidemiology, by definition, is the study of distribution and determinants of health relative events. So, and then the surveillance, the part of the epidemiology, is the ongoing process of data collection and analysis, etc. So HMS-IS is related with this epidemiology and the surveillance systems, and as well as the other issues of the public health. So we will see it now in detail, and now it is HMIS, or Health Management Information System, is a system that provides specific information support to the decision-making process at each level of an organization of health. So, in this, the cycle, there is a situational analysis, priority setting, the setting of objective targets, then is the to make plans, implement, and then evaluation. This is the, the planning cycle. Then we have to see what are the essentials of health management information system. The first is, you have to see, I've already defined many times, inputs. The input for this HMIS is the data on selective activities or happenings that will produce information. So any activity which produces information is our input. Then is the process. In the process essential, the data is transformed into information. We receive the crude data and then we transform it into information by process, and this is collection, aggregation, analysis and presentation on the time in a legible and understandable format. So this is the process. You receive the data and then you collect, aggregate all these informations, you analyze, and to present it to somebody who's responsible for the action. Then what are the outputs? The output in a health information system is, this is the processed information for one or more of users' needs. Then it's the relevance, then there is standardization, that means the uniformity in definitions of variables collected. For example, like whenever we will use IMR, it will mean infant mortality rate. Then there are data collecting and aggregation instruments, and then there is data presentation. These are all the essentials of health management information systems. Now, the other element is flow of information. So whatever the information you collect, it is collected by someone, then it is communicated to different sections, upwards, outwards, and then of course in a tangent manner to different agencies. So there is a flow of information. This is also an important element of the essential of the health management information system. Then it is the use of information. As the information is received, we use in certain pattern. Then there is the one of the essentials are filtration of this information. Sometimes information is in a crude way, so we filter the information to get the right possible and the valuable things, whatever is needed. Then an important essential is the feedback. Whatever the information is provided to someone, you collect the response as well. And then the other essential is the indicators, that are the variables which measure interchanges. For example, these indicators of health, or the social indicators, or the environmental indicators, or the other indicators like IMR, MMR. These are all the essentials of health management information system. Now we will study where this health management information system is used, what are its uses. So as I told you, the uses of epidemiology, if you remember, so HMIS is used for the measurement of health status of the people. You can, if the right information is with you in your system, you can just click to the system and you know what's the incidence and or the prevalence of some disease in some particular area, region, city, or district. And you can also see the number of hospitals, the bed allocated, the number of doctors. All what is in the system is, you see the measurement of health status of the people. And then another use is to quantify their health problems and medical and health care needs. Just when you collect the data and you analyze it, then you can just measure, you can just see the different health problems in the different area, and then you can also guess what is, if when you will look at the determinants, then you can calculate or you can see the medical and healthcare needs as well. So sometimes these needs are to be corrected immediately in an early action is required, and sometimes delayed planning is required. If you forecast something, so the regular, it becomes the regular part of the planning cycle. Then it is used for the comparison of health status at the local, international, and national or international level. So by this HMIS, these information systems give you the comparison between the health status of different cities, districts, localities, provinces. Some countries are on the international, national, and local level. And now this data is also used for planning and administration. Now you know the health status. By this you know the health needs. You know the comparative health status. Then you can plan and administer to correct all these problems, like allocation of budget, placement of medical men, staff, or different technologies, or building of a new hospitals, or the renovation of the hospitals, or providing medicines and other utilities to the deficient areas. So, and plus, if you in the HMIS, if you see any administrative lag, you have to correct, that as well. So you see in the, different times, the different administrative strategies have been used, and we will also, study these strategies, and like in devolution plans, MDGs, and then the CO system and the old system, this in the next lectures. So this health management information system is used for planning purposes and for the administrative strategy as well. Then this information system is used for the management of health services and programs. Different programs are in vogue, like HIV/AIDS control, hepatitis control program. These are the, vertical programs. The anti-blindness campaign, so many vertical programs, and like EPI, these programs are in vogue. And by this health management information system, you can, manage the services and these programs. This is also works as the evaluation process of these health programs. Then it is, it also is used in the assessment of health services. Very, very important. Whatever the services we are providing for the public and for the, for the good, excellent health of the people, how our services will be seen reflected. These will be seen in health management information systems. If the burden of disease is increasing, if the communicable disease prevalence is increased, that will be, there is a slackness in our EPI program or the other preventive measures we have been adapting, or there is some slackness or lack in the health promotion and health communication activities, or some management disorder. So the health services can be assessed through this health management information systems. So what are the sources of collection of health information? So the collection of data must be some, legible and reliable. There must be some reliable sources as well. So what are those sources? So the first is the largest source, the census. So in the census, we see the vital events like births and deaths. And A is in the rural areas, then in urban areas. In urban areas, you get these from the municipal registry office. One has to register birth in municipal office within 4 days. Now NADRA office is also, just recording the births as well. In Sindh, it is the revenue officials. There was a time when, the villages, the local chowkidars, and then there were health departments. They all were, or now in medical institutions, local health authorities, DHO, EDHO, civil service, they also register the, birth records. The death records are available with the, of course, with the hospitals when there is a hospital death, and all with the municipal committees and NADRA in Pakistan as well. Now, there is the sources of infectious diseases reports. So in the hospital, if you all are working in hospitals, you have seen that there are, paper for the reportable diseases. If there is, you find some patient with some reportable disease, you have to, write to the authorities, there are particular form. So 18 health problems are to be reported to those times. Sometimes the number can be, more or less, but nominally it is 18. There are sometimes The others are added and sometimes these are subtracted. So these are the reportable diseases. Then there are the hospitals and dispensaries record. These are records, the registers and other, the record is a source of health management information system. What are these records? These are OPD registers, outpatient registers, the HMIS manner of hospital register, OPD register is quite different from the old register used in the previous times when there was only the serial number and name of the patient and age was entered. Now there are columns, also the age, then the disease, then of course there are certain others, standards of entry. Then there are indoor registers, then there are abstract registers of daily tabulation of diseases, and then there is annual return. And there are then also daily reports, monthly reports, quarterly reports. Then there is health manpower statistics. How many number of doctors have been registered, how many are working, what are the number of nurses working in the country or the province, and how many paramedics are there, how many health technicians are in our country, and that is we take by Pakistan Medical and Dental Council or Pakistan Medical Council, whatsoever it is. Again it is for PMDC, then there are nursing councils and other institutions as well. Then there are population surveys which are used for the mortality and nutritional surveys in other countries as well. And so you can, it is also a source of the health management information system. Then is another source is what I told you in the intro, it is the surveillance system. This epidemiological surveillance system is an ongoing process. You see the prevalence of malaria, TB, and other diseases in that system, which is also the reporting is a source of HMIS. Then there are certain definitions which are used in health management information systems. The first is first level care facility, FLCF. So whenever in an information system you see FLCF, it will be a first level care facility. And what is a first level care facility by definition? It is a facility where there is first contact between a client and a patient and a healthcare provider. So it is a first line care facility. Then is a basic health unit, BHU, a rural health center, RHCs, then a dispensary, DISP, then sub health center, HSC, and first aid post is FAP, MCH center, maternity and child health center is MCH, and OPD of a hospital is outpatient department of a hospital. So these are the terms used in the language of health management information systems. Then after this first level facility, there is a referral level care facility, RLCF. So what is a referral level care facility? It's a care provider. So what care they provide? They provide curative care, they provide preventive care, and then is the first is a referral care facility, is a care provider, then are patient and client. Now we see what are the indicators. So indicators are the variables which help to see to measure the changes. And that, there are some functions, they turn into activities, then there is the achievement objectives, these, and in between is the indicator. And you are all well know, we have told you the indicators of health and all that. Then there is data collection, health information system in the first level, care facility. For patient client management is 11 record cards. In the first level care facility, there are 11 record cards, there one or less, but there are 11 record cards which are present in the first level care facility. And in facility management aggregation, there are 19 registers. Then how you use this information, it is used for the immediate feedback. It is for immediate feedback, it is used by the data collector. Who is, collecting the data, he will give immediate feedback. Then there is feedback from the higher levels. When you transmit this information to the higher level, you get feedback and instructions from the higher level. Higher level, and then what are the data collection instruments, facility based? These are the report forms, and these are immediate report, monthly report, and yearly report. And the transmission of monthly and yearly report is from the facilities up to the level of the tehsil level officers, district level officers, then to the provincial, the regional officers or divisional officers, to the provincial officers, and of course the federal and international levels. So this is the transmission of reports. And this is all about health management information systems. Thank you very much.